Hello everyone, this is Dr. Praveen Tripathi and with me is Dr. Kautilya. Dr. Kautilya got a beautiful rank of 487 in the recently conducted NEET PG exam. So Kautilya, many congratulations first of all.
Thank you, sir.
So Kautilya, can you tell us a bit about yourself, from where you did your MBBS, which attempt was it?
So basically, I hail from Jaipur.
Mm-hmm.
I did my undergraduation from Kasturba Medical College, Manipal.
Mm-hmm.
And this was my first attempt along with the internship.
So you appeared for this exam along with the internship itself. All right.
Yes, sir.
And did you appear for the exam in the morning session or the evening session?
So it was the evening shift.
It was an evening session. Nice. It's nice to interview students from the evening session. All right. So,
We're
Kautilya,
hearing a lot of things.
yeah, we are hearing a lot of things. We do not know how much of that is true. I mean, did normalization happen? And if it did not happen, how much role is it playing in the ranks and all? We do not know about that. When we can just hope that it's fair, because somebody who was getting maybe rank 100 is getting rank 1000 because of lack of normalization. That would be very unfair.
Yes, sir.
It's just hoping that it's fair.
Yes, sir.
Okay, Kautilya. So we were having a little discussion before we started this interview, Kautilya. You told me that you started your preparation pretty early. So tell
Yes,
us a
sir.
bit about it. When did you start preparing for PG seriously?
So I started preparing for the PG entrance since my third year itself.
Okay.
So I did not do anything extra. I just did the third year and final year subjects along with the particular year. And then in internship, I did the rest remaining short subjects and the first and second year subjects using revision videos.
So your voice was breaking a bit. So what I heard is in the third year, you did the third year subjects. Final year, you completed the bigger subjects and the shorter subjects
Okay.
were in the internship.
Yes, sir.
And you revised the first and second year subject also in
Yes,
the
sir. Yes, sir. I did the first and second year also in the internship using revision videos.
Okay.
And then I revised them, yes.
So Kautilya, you were telling me that the main source of content for you were the revision videos, the rapid revision videos
In the internship, yes, sir.
in the internship. So
And I
earlier you
stick
had,
to my source, sir.
and you,
Third and final year, I did my main notes and I stick to that only.
okay, so
In
you
the
use the
internship also
main
for
notes in the
revision.
third and final year, but in the internship you use the revision videos.
Yes, sir. Because of lack of time, I didn't have the time to do it. I initially tried doing subjects, but it was taking a lot of time.
Okay. So, but you
So
still
I
revise the
switched to
main
the
notes that you had used in the past.
Yes. Third, fourth year, I did completely from the main notes.
Okay.
Even
So
in
wonderful.
the internship.
Wonderful.
Yes.
So that sounds like a great strategy that if somebody has, completed the main notes in the MBBS itself, then it becomes a bit easier in the internship. So Kautilya, tell me
Yes,
one
sir.
thing. Were you like a topper throughout the MBBS? Or one of the toppers?
No, sir, I was pretty average during the MBBS.
Pretty average. Your rank does not seem to be pretty average. Are you sure you were an average student?
Yes, sir. Yes, sir. Average student only.
Okay. All right. So what about the MCQs? How did you manage the practice of MCQs during your preparation?
So initially, whenever I was doing any subject,
Mm-hmm.
after doing that particular subject, I used to do all the previous year questions of that subject,
All right.
all AIMS papers and all NEET papers.
Okay.
So after each subject, I used to do that, and also 2 subject tests I used to give. And
Two
then,
subjects. Okay. Okay.
yes, like
Okay.
whichever is the running year and 1 year before that also.
Okay.
Then I used to, towards the end, I also started using the late night PYQ marathon also along with it.
Okay. So the
Yes.
late night PYQ marathons were started by Cerebellum with the idea that, some of the older PYQs should also be covered. So, I mean, after the exam, there was a
Yes.
lot of,
So,
so please go ahead. Yeah.
sir, essentially, I did almost all the PYQs almost twice because of this. Because regularly I did once in my Q bank, and then because of this, I revised. And it helped me
Okay.
a lot because all the subjects were there in those 80 questions. So it was almost like a capsule revision every day.
Every time. Wonderful. In fact, you were telling me that almost 80 to 90% of the late night PYQ marathons you attempted.
Yes, sir. Yes, sir.
So what do you think, Kautilya? I mean, the pattern of the exams are changing, but the PYQs, I mean, it has been said that PYQs always form the base of the preparation. Do you think that has
Yes.
changed now, or do you think that is still the case?
So like straight PYQs are not
Hmm.
there anymore, but
Hmm.
PYTs are very important. So
Right.
whenever I did any question, I used to review it completely. But this
Okay.
is not a strategy that is recommended or followed by many students, but
Hmm.
I usually did all the reviews thoroughly.
Okay.
I invested a lot of time in questions and the reviews because PYTs are repeated. And even in this paper, I experienced that almost 45 to 50% paper was from previous year topics, important topics.
So, Kautilya, in the PYQ marathons and in the Q Bank in general, we started adding that educational objective part in the end, just to ensure that the
Yes, sir.
crux of the concept is
Yes,
taken
sir.
care of. So was it
Yes, sir.
helpful?
Yes, it was very helpful, sir. Like in the end, when there was no time to review the questions, then
Hmm.
just for the questions that I got wrong, I just used to read the educational objective and
The
get
education.
done with it.
That's nice to know. Last thing that I want to ask you, Kautilya, is say a student is just starting with the preparation. What would be your advice to that student as far as the GTs are concerned, grand tests are concerned?
So I gave almost monthly GTs
Okay.
since the beginning of my internship.
Mm-hmm.
And in towards the end, like December, January, February, I gave almost two GTs a month
Okay.
and I reviewed it thoroughly. And the review is very important. So I
Review is
used
very
to
important.
review like 20 questions per day because otherwise then it takes your whole 2 3 days and that becomes stressful. And that is why people don't attempt GTs. So I used to just span it out on 7 days, 10 days,
And
20,
and
30 questions
should the
every day.
student start taking GTs as early as possible, or should he wait for some
So
part of
as
the course
early, no, as early as possible.
as early as
It's
possible?
very important that we practice questions and get a exam environment.
Wonderful. Kautilya, do you
And
plan
basically, the graph is important, sir. It's
graph? Okay. Okay.
it's
The
the
graph should be going upwards.
graph in the GTs.
Hmm.
Yes, sir. The score doesn't really matter much.
Right. The comparative analysis is what matters. Do you plan to take a surgical
Mm.
branch, Kautilya?
So I'm not sure yet about the branch, but
Your
uh,
demeanor is that of a
I'm
surgeon.
basically, yeah.
You would
My
you would
father
make a
and mother
great
both are
orthopedician.
surgeons. Both of
Ah,
my
okay.
parents are
So
surgeons,
surgery is
but
in the gene.
yeah, surgery is into contention, but I'm not sure yet.
You take orthopedics. You would be a great orthopedician. I mean, just by looking at you, I can say
Not
you
orthopedic.
response very nicely. Uh,
If I take surgery, I'll take up general surgery, sir.
General surgery. Wonderful. All right, wonderful, Kautilya. Thank you. Thanks a lot. Again, many congratulations again. And thank you for sharing your journey with us. Any last advice that you have for your juniors who are going to prepare for the next year exam?
So that only just be consistent with studies and the results will show. Every day, do something, even if it is a hectic internship or whatever. The results will come eventually.
Show up every day and the results would come. That's so nicely
Yes,
said. Thank you, Kautilya. Thanks a lot for taking out time and thank you for talking to us. And again, congratulations. Thank you.
thank you, sir.